Hello everyone, and welcome to today's lecture, Collecting, Processing, and Testing Blood Specimens. From this lecture, we will achieve the following learning objectives: the role of the medical assistant when collecting, processing, and testing blood specimens, the equipment needed to collect a blood specimen, ways to communicate with patients and to respond to their needs when collecting blood, the procedure for collecting a blood specimen, and the procedure for performing blood tests. The role of the medical assistant. The role of the medical assistant in obtaining blood specimens includes phlebotomy. Phlebotomy is withdrawal of blood from a vein and is done by using a procedure called venipuncture. Using a needle to withdraw blood from a vein, or capillary puncture, using a small, disposable instrument to pierce the surface of the skin. Preparation for collecting blood specimens. The patient should arrive with a laboratory requisition form, or the HER, which will reflect the licensed practitioner's order for laboratory testing. Equipment for drawing blood. Equipment for drawing blood will have been prepared for the procedure and includes many supplies, including a tourniquet used to restrict flow of blood. Different kinds of sharp devices and various methods are used for venipuncture. Some of the methods and kinds of equipment they are used are as follows. An evacuation system. It uses a double-pointed needle and collection tubes, which are sealed to create a slight vacuum. Often an additive is already been included in the collection tube. The butterfly system. The butterfly system is used for patients with small or fragile veins. Flexible wings are attached to the needles to simplify insertion, and tubing connects the needle to the collective device. This system generally uses a smaller needle than other techniques and can be used along with the evacuation or syringe system. The least desirable system of collecting blood is with the use of a sterile needle and syringe. The blood collected in the syringe must immediately be transferred to a collection tube. Collection tubes. A collection tube is a sterile glass or plastic test tube with a colored rubber stopper creating a vacuum seal inside of the tube, facilitating the drawing of the predetermined volume of liquid. Collection tubes are different colors to identify the types of additives contained within. Additives include anticoagulants such as ethylene diamine tetraacetate. Capillary puncture is accomplished with a small disposable instrument with a sharp point called a lancet. An automatic puncturing device preloaded with a lancet may be used for more precise puncture. The blood collected from the tiny puncture is placed in a calibrated glass tube called a micropipette. Other tiny containers are also used with different colored tops, indicating additives they may contain. Some tests will not require processing of the blood specimen and instead will be done with the use of chemically treated paper or plastic reagent strips. A smear slide is a thin layer of unconsolidated sediment embedded on the glass slide for petrographic microscopic examination. Drops of blood may also be applied directly to a slide for examination under a microscope. Patient preparation and communication. Patient preparation and communication involves the following: greeting and identifying patients. The patient should be greeted pleasantly and identified as the correct patient for the correct procedure. Confirming pre-test preparation. Any pre-test instructions should be verified as having been followed. Explaining the procedure and safety precautions. The procedure and safety precautions should be explained to the patient clearly and briefly. And establishing a chain of custody. Specific guidelines may need to be followed for chain of custody. Patient preparation and communication. Patient fears and concerns. Patients are often fearful of needles and the process to draw blood. Be honest when asked about the pain factor. It may be helpful to have the patient focus their attention on something other than the procedure or to close their eyes during the poke. Tell the patient to inform you if they feel lightheaded or faint. A bruise may occur if blood leaks from the vein and collects under the skin. This can sometimes be prevented by releasing the tourniquet before withdrawing the needle and applying pressure over the puncture site after the needle is withdrawn. Bruising is more commonly noticed with fair-skinned patients. Scarring would be unlikely. Patients may fear their condition is serious, as evidenced by the amount of blood being withdrawn. The emphasis should be on health rather than disease, and the patient can be assured that the practitioner is looking for normal levels and at what levels medications may be acting in the blood. Patients also may be concerned they will contract a disease from an invasive procedure secondary to bloodborne pathogens. These patients will be reassured with an explanation of precautions used to prevent transmission of infection from one person to another. Special considerations. It may be challenging to obtain an adequate blood specimen from some patients for various reasons. Some facilities will use an instrument called a venoscope to visualize the vein and make it easier to locate. Sometimes there will be a need for another person to try to obtain a specimen. Apply warm blankets to the area may help, or have the patient move and pump the extremity. Some patients will have a reaction and faint at the sight of blood. Most patients revive promptly but don't leave a person alone. If there is more severe reaction, such as a seizure during the blood draw, call for help but remain with the patient. Breathing must be monitored and maintained. The licensed practitioner should be consulted and office protocol followed. Some patients may become very emotional during a blood draw and refuse the test. Never argue with the patient or force the issue. Report the problem to the appropriate staff and follow office protocol. Performing blood collection. Venipuncture. The most common site for venipuncture is the median cubital or cephalic veins of the forearm. Capillary puncture. Capillary puncture is generally done on the middle or ring finger of the patient's non-dominant hand. The central part of the pad is the most sensitive, so it is more comfortable for the patient if the procedure is done slightly off-center. Capillary puncture in infants is usually performed on one of the outer edges of the underside of the heel. Blood cultures. Blood culture specimens are collected to test for the presence of bacteria in the blood. It is important that no skin organism contaminate the specimen. While venipuncture is generally a safe procedure, there may be complications. Hematoma is a collection of blood which forms under the skin. This is more common in the elderly or for people taking anticoagulants. The needle should be held as still as possible while filling and changing tubes to prevent hematoma. Some people will have latex allergies, which may be affected by gloves, tourniquet, and bandages. Most offices no longer use latex products. However, always ask the patient if they have a latex allergy if this is not the case. Inserting a needle into a nerve can cause nerve damage, with permanent sensory or motor damage if venipuncture is done incorrectly. The anatomy of the antecubital fossa should be known for accurate location of the proper veins for venipuncture. Infections are rare but could occur and be very serious after venipuncture. The area should be cleaned well before the procedure and universal precautions followed. For any of the complications of venipuncture, the licensed practitioner should be informed and consulted. Performing common blood tests. The results of individual tests can provide information that aids in the diagnosis of specific conditions, diseases, and disorders. Several chemical substances may be used while performing common blood tests, including anticoagulants, which cause the blood to stay in a liquid state, serum separators, which form a gel-like barrier between serum and the clot in a coagulated blood specimen, stains, which color specific types of cells, making microscopic study easier. Hematologic tests. Hematologic tests include the following: blood cell counts, morphologic studies, coagulation tests, and the non-automated erythrocyte sedimentation rate test. These tests can be performed on venous or capillary whole blood specimens. Whole blood contains formed elements of red blood cells, white blood cells, and platelets, along with the liquid portion called plasma. A complete blood cell count will include the number of red and white blood cells, along with the percentage of each of the different white blood cells, called differential. The platelet count is estimated, and hematocrit or hemoglobin counts are determined. For the differential cell counts, a stain is applied to distinguish the 5 different types. These include neutrophils, basophils, eosinophils, lymphocytes, and monocytes. The hematocrit is measured after spinning a sample of whole blood in the centrifuge to separate the packed red blood cells from the outer parts. The buffy coat contains the white blood cells and the platelets. Automated hematocrit readers may also be available. Hemoglobin resides within red blood cells, and measuring the concentration requires rupturing the red blood cell to evaluate the color of the specimen. This procedure is done with the hemoglobinometer. Morphologic studies examine the shape or form of objects and require special training. Coagulation tests may be ordered to identify potential bleeding problems. Several automated testing devices are available. The erythrocyte sedimentation rate, or ESR, is the rate at which red blood cells settle in whole blood. The distance they fall is 1 hour when allowed to settle, and a calibrated tube is measured in millimeters. This screens for the presence of an inflammatory process. Chemical tests. Chemical tests are rarely performed in the POL because they require expensive, sophisticated equipment and techniques. Also, complex testing is subject to strict CLIA regulations. However, blood glucose monitoring is one of the blood chemistry tests routinely conducted in the POL. The patient can also be instructed to perform the test at home. The hemoglobin A1C is also used to monitor the health of diabetic patients. This test measures the amount of glycosylated hemoglobin in the blood. The test results provide an idea of the average blood sugar for 2 to 3 months. Cholesterol tests also are done on a routine basis at the POL. Automated devices can be made available for home use as well. Serologic tests. Serologic tests detect the presence of specific substances in a blood specimen. An antigen or antibody is introduced to the specimen and detection is noted of the specific reaction. Amino acids includes the Western blot used to confirm an HIV infection. Radioimmunocy tests are radioisotopes to tag antibodies. Enzyme-linked immunosorbent assay is used to identify a reaction signifying HIV infection. Immunofluorescent antibody tests use a dye which is visible when the specimen is examined under a fluorescent microscope. Rapid screening tests have been developed for quick processing. Pregnancy tests are an example of a rapid screening test designed for home use. Other tests available for use in the POL will detect mononucleosis, HIV, or Helicobacter pylori infections. That concludes today's lesson.